Hi, I'm Dr. Lexi, and I just wanted to tell you guys a little bit more about what Dr. Lexi is. I am a maternal-fetal medicine specialist, so I am board certified in OBGYN and maternal-fetal medicine, which is basically considered high-risk pregnancy. And so I did 4 years of training in OBGYN, which includes a residency, and then 3 years of training in maternal-fetal medicine, which is considered a fellowship. And in doing that fellowship, I learned more about the complexities of pregnancy, high-risk pregnancies, as well as ultrasounds to really look at a fetus, and that's kind of where we get the maternal fetal medicine side of what we do. So it's complications that can be with the patient or complications with the pregnancy, or as I like to call it, the passenger or the fetus as well. So I did that training 7 years after medical school and currently practice maternal fetal medicine in small underserved areas and do full-time telemedicine. So that's kind of who I am as a person and as a doctor in general. One of the questions, I guess, could be, what is Dr. Lexi? And this is something separate from what I do as a maternal fetal medicine specialist. So in being in smaller towns and doing telemedicine remotely and going into via the computer screen, towns that are smaller, like towns that I grew up in, I am able to see the need that individuals have in these smaller towns that may be considered what they call a desert from healthcare, specifically for high-risk pregnancy care. And when I'm talking to these individuals in these smaller towns, even individuals that I used to consult on in the larger, bigger cities, number one, I noticed that I didn't have much time with them. Number two, by not having much time, I wasn't able to educate them as much as I wanted. And number three, I felt that it might be that the system is failing them from time to time. Now, I have my own medical problems, and I feel like the system has been difficult to navigate for myself through personal medical problems. And for my individual patients, I want to give them the best chance they have to navigate for themselves through a pregnancy. Whether it's complicated or uncomplicated, everybody should have the opportunity to ask questions to their provider. And so what I'm trying to do with Dr. Lexi is provide a way for individuals, for the patients themselves, to learn how to navigate their pregnancy better. And I'm doing that through these 3 pillars. I call these E, D, and I, E.D.I. And the first is expanding knowledge. So what I'm trying to do is help individuals learn more about whatever topic that they want to learn about, and so I'm trying to put those topics generally on YouTube. I'm also trying to put topics on my website that are more in-depth for those individuals that have something going on making them a high-risk pregnancy. So expanding the knowledge is about learning more about the topic so that you can understand and break it down, getting the definition of what's going on for you maybe, or some data surrounding the topic at hand. Then we have developing skills, and that's the D portion here. And so developing skills is for you to be able to learn how to ask specific questions to your provider, how to advocate for yourself by looking at certain websites, filling out certain forms, possibly online, that could help you understand if you are or are not at certain risks during your pregnancy for certain things. So developing skills is really about diving deeper into these topics, learning more about the questions to ask your provider, and ways in which you can self-advocate during your pregnancy. And then the last portion is I, and this is impact lives. The goal of what I'm doing is trying to have a positive impact on you, your pregnancy, and ultimately also the lives of those around you. So as you're learning more about individual items during pregnancy and expanding your knowledge and developing your skills, the goal is to have a wonderful impact that is positive for you, positive for your pregnancy. And again, ultimately learning all of these skills, being able to pass them along to others, share this information, and have an impact maybe in your community, maybe to a sister or a family member or someone that you've wanted to help out. Those are the pillars that I have. That is kind of the core of what Dr. Lexi is based upon, with this portion of trying to assist pregnant individuals to self-advocate for their pregnancy with the ultimate goal of having a happy and healthy pregnancy. I am Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which now you know just means a high-risk pregnancy doctor. And I am here to help you navigate this pregnancy.